Bismillahir Rahmanir Rahim. Assalamu alaikum. I am Professor Adam Ahmed Adam. You are welcome to this parasitology lecture. It is about trypanosomiasis. This parasitic disease is caused by the protozoan flagellate Trypanosoma species. The disease is classified into two types, African and American. The African trypanosomiasis is also known as sleeping sickness. It is caused by Trypanosoma brucei. The vector is the Glossina species, also known as tsetse fly. This fly is a salivarian one, that is to say the infective stage is found in saliva. The infective stage is the metacyclic trypomastigote. The other type, the American, it is also known as Chagas disease, caused by Trypanosoma cruzi. The vector is the stercorarian bug. Stercorarium because the infective stage is found in feces. The infective stage is also the metacyclic trypomastigote. African trypanosomiasis, the sleeping sickness. This disease is found exclusively in Africa. It is nowhere in the world except Africa. It is found between the latitudes 14th north and 29th south. It is caused by two parasites of Trypanosoma brucei. Trypanosoma brucei gambiense and Trypanosoma brucei rhodesiense. The gambiense is found in West Africa. This disease is non-zoonotic. The parasite is transmitted between humans. It constitutes the vast majority of cases, about 98% of African trypanosomiasis cases. The vector is the Glossina palpalis. This tsetse fly is found near rivers and lakes. The other one, Trypanosoma brucei rhodesiense, the disease here is found in East Africa. It is zoonotic. The parasite is transmitted from animals to humans. It constitutes about 2% of African trypanosomiasis cases. The vector is the tsetse fly Glossina morsitans. It is found in woods, woodlands, and rich savanna. I would like to mention here that both male and female, these flies, both males and females transmit the infection. We come here to the sequence of events starting from infection up to the parasite in the central nervous system. We start with the bite of the Glossina palpalis. It transmits the Trypanosoma brucei gambiense, and here the infecting or the infective stages will reach the lymph. They stay there for some time, the lymphatic channels and the lymph nodes, and then they reach the blood. From the blood, they reach the central nervous system, they cross the brain-blood barrier, causing meningoencephalitis. This course is if compared to the other one is slow course. It takes time. The other type transmitted by Glossina morsitans, it transmits Trypanosoma brucei rhodesiense, and after the bite, the infecting parasites reach the lymph and rapidly to the blood, early in infection to the blood. Then they cross the brain-blood barrier, reaching the central nervous system, causing meningoencephalitis. The course in this type is rapid compared to that caused by Gambiense. The incubation period for Trypanosoma brucei rhodesiense ranges from 2 to 3 weeks, a short time compared to that. But in Gambiense, it ranges from 4 weeks up to 11 months. At the site of the bite, a canker may appear. At the end, it heals. This is a very important point here in this slide. Variant surface glycoproteins. These are found in the parasites, giving them the property of antigenic variation, changing their antigenicity. And here we say human immune system alone cannot get rid of the parasites, because the parasite changes its antigenicity frequently. And so here the parasitemia will fluctuate, going up and down. After infection, the immune system will work to build immunity against the parasite, and it succeeds in killing the vast majority of the parasites. But before getting rid of them all, the remaining parasites will change their antigenicity and they appear as if they are new parasites to the immune system. Then the immune system will act against them again, and this will go on. This will lead to fluctuation of the parasitemia. And the immune system will not be able to get rid of the parasites. At the end, the patient will die if not treated. The clinical manifestations, the first stage and the second stage. The first stage, the stage where the parasite is not in the central nervous system. Before reaching central nervous system, the patient here will feel malaise, fever, headache, cervical lymphadenopathy. In the second stage, and this stage, the parasites are in the central nervous system. There will be stiff neck, depression, inversion of sleep rhythm. The patient remains awake during the night and sleeps during the day. There will be progressive mental deterioration, focal seizures, tremors, and pulses. If African trypanosomiasis is not treated, the patient is not treated, the patient will die. In case of Trypanosomiasis rhodesiense, the death may occur within several months of infection. But in case of Gambiense, the death may occur within 3 years. Diagnosis, clinical assessment, their laboratory investigations. In the first stage, the parasite before reaching the central nervous system, for rhodesiense, the best specimen is the blood. But for the Gambiense, lymph node aspirate. But in the cerebral stage, the second stage, it is a CSF, which is the best specimen for the cerebral stage of the disease. You can stain the specimen collected after making a film by Gimsestein, and you see the trypanosomes between the red blood cells. Treatment, the earlier the better. If the patient is diagnosed early, treatment starts early, the prognosis will be favorable. For Trypanosoma brucei gambiense, in the first stage, the drug pentamidine or suramine. In the second stage, cerebral stage, fluoronidine. For rhodesiense, the drug is melarsoprol. By this, the lecture is over. I hope that it is understandable, and I wish you all the best.